All right, we're going to go ahead and get started, everybody. Hello and welcome to the West Michigan Vaccine Clinic briefing. I'm Carrie Manders. Good to see everybody this afternoon. Our objective today will include giving you a preview of the new collaborative vaccine clinic that is slated to open on Monday, January 25th at DeVos Place. We will start this briefing with some opening remarks from Dr. Adam London, Director of Kent County Health Department, Dr. Daryl Almucci, President of Spectrum Health West Michigan, and Dr. Young Kim, President of Mercy Health St. Mary's. Following their remarks, we will open up to questions from the media. Please place your questions in the chat and we will call on you when it's your time to ask the question live. We will answer them as time allows in the order that they were asked. Dr. London, I'm going to turn it over to you to get us started this afternoon.
Thank you, Carrie. You know, it was 1 year ago that our world was forever changed by the arrival of the coronavirus, which causes the illness that we now know as COVID-19. It's been a tough year. We've lost an awful lot. Most importantly, we've lost the lives of over 400,000 Americans, including almost 600 of our family and friends here in Kent County. And I know I speak on behalf of my friends, Dr. Almucci and Dr. Kim, when I say that our hearts and our healthcare teams deeply grieve each and every one of those losses. And that's why we're so excited about today's announcement. We are pleased to tell you about how we are working together to open a collaborative, large-scale vaccination clinic here in downtown Grand Rapids, a site we are calling the West Michigan Vaccine Clinic at DeVos Place. We know that many people throughout our region are working very hard to get control of this pandemic and return to normal life as quickly as possible. We want to thank you, the people of West Michigan, for all your sacrifices and your commitment to wearing masks, social distancing, practicing good hygiene. All of these actions remain critically important, but we know that we cannot get through this without a vaccination program that is sufficiently scaled to move vaccine as quickly as possible. And that is what this West Michigan Vaccine Clinic at DeVos Place represents. Each of the partners speaking here today and many other regional organizations represented by the West Michigan Vaccine Collaborative are absolutely committed to making sure that we are doing everything in our possible to roll this vaccine out in our community in new and innovative ways. And we're doing that in a way that's never been done before. And doing that in record time is critically important to us. This large-scale clinic is part of our plans to make vaccine available to our region at large, while our organizations also work on very strategic and targeted efforts to drive health equity and bring vaccine to people in our community who have been disproportionately affected by COVID-19. Here at Kent County, we're very grateful to the partners that we have. And with that, I'd like to ask Dr. Daryl Almucci, President of Spectrum Health West Michigan, to speak. Daryl?
Thank you, Dr. London. I really appreciate it. And I couldn't agree with you more. This is truly an exciting day. And here at Spectrum Health, we're incredibly proud to be a part of this collaborative effort. A key part of this new clinic is that we can truly scale it to give thousands of vaccines a day to community members. And it's through partnership and collaboration like this, we're able to provide such a large amount of vaccines in short order. Obviously, as we all know, the key is going to be receipt of vaccines so we can actually administer them. And that we will follow very closely. Right now, there's still limitations on the vaccines we all receive. We hope that scales in very short order. And our goal would be to provide up to 20,000 vaccinations per day at the new clinic. It's key to emphasize that these vaccines will only be administered by appointment only. We're not able to vaccinate walk-ins. We've set up an easy registration process and a website, www.wmvaccineclinic.org. For those without internet access, we've created a call center and a number will soon be made available later today. And I will tell you that just administering this vaccine is not enough. We also want the experience for receiving the vaccine to be positive. That's why we focused on a centrally located site in downtown Grand Rapids that can serve a wide region and allows for social distancing. It's easily accessible via highways and is located on the bus line. Parking is located under the facility and across the street. And because of this facility size, it will be efficient for us all to operate. We'll start small, mainly based on vaccine availability, but as I said, we hope to increase capacity significantly as we receive more vaccine shipments in the coming days and weeks. We are all still offering other sites, recognizing we cover a broad region and that some people might find other sites more convenient or closer to them, but our goal truly is to vaccinate all. So with that, I'd like to ask Dr. Young Kim, President of Mercy Health St. Mary's, to say a few words.
Thank you, Daryl. I want to start by echoing the excitement shared by Drs. London and Almucci. We at Mercy Health are so pleased to partner with Kent County Health Department, Spectrum Health, and Vaccinate West Michigan to serve the community in this way. We believe that by working together, each of our organizations can better care for the community and also administer the greatest number of vaccine doses. Fortunately, we have similar missions around improving and maintaining the health of the community, and that makes our partnership a really good fit for all of us. This partnership came about pretty naturally. Hard to believe it, but it's already been a year since we've been talking and coordinating on COVID. And so, it really flowed naturally from that. And specific to the vaccines, I guess it was just a few weeks ago that we brought our teams together to decide how we would cover Group 1B and start with the first responders and K-12 teachers and staff. That also made clear and paved the path to rapidly agree on the kind of a large community vaccination clinic that we thought would be necessary. I'm thankful. We're all thankful for the tough and really fast work and the collaboration of our teams for making this vision become a reality so quickly. And I want to emphasize, as Daryl did, that this is in addition to what we've already been doing. And so, this means another great option for a location that really meets your needs and different ways to get it. As for example, in Mercy Health St. Mary's, we have a stay-in-your-car drive-through option in addition to this one. And overall, this means that we're very fortunate in West Michigan to have organizations that are so focused on sharing goals for the health of the community. Finally, I want to thank all of you for being with us today and helping us to spread this positive message. Carrie?
Thank you, Dr. Kim, and thank you to each of our speakers. I also want to make the media know that we're joined by Brian Brasser, who is our Chief Operating Officer of Spectrum Health Grand Rapids, who will be assisting with the operations of this clinic. So he is here this afternoon to help answer your questions. With that being said, please go ahead, type your questions in the chat. Please identify what media outlet you are with, and we will go ahead and turn to your questions. So for our first question, I am going to turn to Joanne Boorsma, I believe from WKTV. Joanne?
Yes, I was just curious, being that it's downtown in DeVos and there's a fee for parking, will the parking fees be waived for those coming in to get the shots?
Great question. Brian, do you want to take that question?
Good afternoon. Thank you for that question. We are working right now. This has come together over the last several days. Initially, yes, and we are continuing to pursue. But at this time, as patients are being directed to park underneath DeVos Place, their first 2 hours will be waived, which gives them ample opportunity for them to come in, register, get their shot, wait for that 15 to 30-minute period, and then be on their way. So we're very pleased with that and are continuing to work with our partners to extend that even further.
Thank you, Brian. Let's go to Brian McVicker from MLive for your question.
Hi, good afternoon, everyone. Just wondering if you could tell me how many doses you folks expect to be offered on a daily basis initially when it starts operating Monday, and when do you folks expect it would reach that 20,000 daily goal?
I don't know if that's a question, Daryl, you want to take?
I think I actually had best give it to Brian because he knows the exact numbers of this week.
Sure. So for this coming week, we have allocated about 7,200 doses These are first doses, of course, because folks will be receiving their first. Unfortunately, right now, the constraints on supplies are nationwide. We're working very, very closely with Lansing, with the Department of Health and Human Services, the Governor's Office. They are continuing to refine their process for distributing and allocating vaccines. So the reality is at this time, there's a bit of an unknown. I think the key message is that from the west side of the state, we're ready. And so it's hard to project when exactly we can ramp up. The silver lining is we'll learn through this. We will allow our team members to get acclimated here. We'll be scaling up to recruit volunteers to support. And then as that vaccine becomes available, we'll be ready. And I think this gives a compelling argument for this side of the state.
Thank you, Brian. Mark Sanchez, to you.
There we go. Am I working this time?
You are.
Good. I was curious in looking at your advisory, I noticed Metro Health was not part of this collaboration. Any indication as to why not, or may they become part of the partnership at a later date?
Dr. London, I'll turn it to you for that question.
Yeah, thanks, Gary, and thanks, Mark, for the question. To be clear, Metro Health, U of M, is a part of our West Michigan Vaccine Collaborative, and they have been a huge partner to us in public health throughout this vaccine campaign. So this is not any sort of problem with Metro Health. They are a huge partner and contributor to what we're doing. In looking at what they were currently offering with their vaccine resources, they determined that joining this probably wasn't to the community's really best interest, that they were better positioned to look southward and to look at the area where they're physically located and to bolster those efforts in order to make vaccine more accessible in more places throughout the community. So again, they're a huge partner. This is just really based on how and who this best fits for this particular site at DeVos Place.
That said, if I can build on to what Dr. London said, you know, I think in our discussions, we're absolutely open to Metro or any of the other health systems or others in the community who would like to join in and be a part of this effort. We think the more the merrier. Yeah,
thank you for that, Dr. Kim. And we already have some others that are reaching out to us asking how they can contribute, staff, vaccine, or other resources. So we're very encouraged this is going to be a larger partnership.
Appreciate both your comments on such a great collaborative effort. Why don't we turn over to Dustin Dwyer from Michigan Radio.
Yeah, I just wondered if each of you could give an update on how many people have been vaccinated so far by Kent County, by Spectrum, and by St. Mary's.
Adam, do you want to go first, and then Daryl, and then Dr. Kim?
Yeah, so I think in total, the Kent County Health Department, and I'd have to check my numbers, but I think we have received about 8,000 doses, and those have all either been administered or they're scheduled to be administered in the next couple of days. And we are currently receiving week over week about 3,000 doses, which we are scheduling each of those doses every week. That's our goal, use them all every week, and we hope to get more very soon, that we can start reallocating to this particular site at DeVos Place.
Great. And from Spectrum Health's perspective, recall that we're administering vaccine in the far southwest of the state in our Lakeland facilities, all the way up to Ludington. And so thus far, we've given out about 43,000 doses of the COVID vaccine and have about another 30,000 scheduled, most of those being second doses. So we've really tried to ramp this up as best we can given supply constraints.
And for us as Mercy Health St. Mary's, by the end of the day today, we will have administered about 14,000 of the 15,000 doses that we have.
Great, thanks for those updates. Joe LaFergie from Wood TV8.
Hi, good afternoon. Adam, you talked a little bit about supply, so did Brian. How difficult has it been to predict that weekly supply, and how much patience on the part of the public is going to be required of this?
Yeah, Brian, I don't know if you want to take that question.
This is one where it's very hard to predict, and on a week-to-week basis, usually it's on Thursday or Friday when we get the confirmation. Each week there's a process by which we submit, and we submit for first doses and second doses. We have the opportunity for each site to request both Moderna and Pfizer. I will say that we have had a very consistent supply of second doses. That has not been an issue. However, there is always that concern. The way the federal government has set it up so far is that typically that second dose comes 3 or 4 weeks after that first dose does, recognizing the differences in when that second dose is scheduled. So one of the things that we've really made a specific point to do is to not schedule first doses until we have those in hand. And so when somebody gets an appointment, and this will hold true here as well at the DeVos Place Clinic, at the West Michigan Vaccine Clinic, it will be that we have that vaccine in hand. And so that's really important because it has been very sporadic. We've seen that in the news media. We're excited about potentially some changes to how the vaccines will be delivered across the country. And so at this time, we're asking for patience. As we said, we're ready so that when that time comes and when we can see a more consistent and larger supply, we will be ready to meet the needs of our community.
Thank you, Brian. Let's go back to Brian McVicar for another question. Hey there, Brian. I'll go ahead and ask.
Apologies. Just wanted to double check, is this clinic open to anyone who lives outside Kent County, or is it just geared towards Kent County residents?
Daryl, do you want to answer that question?
So we've all come together recognizing that all of us, the health department, St. Mary's, Spectrum Health, all of us are dedicated to giving as many vaccines to as many Michigan residents as possible. Obviously, from a convenience standpoint, this will be very convenient for Kent County residents, but we recognize that people across the state, on the west side of the state, will likely come, and we welcome them. We want to vaccinate as many people as we can.
And then just one quick follow-up question, if possible. Are you folks able just to restate
Oh, Brian, I think we lost you.
My apologies. Just one quick follow-up question. Are you folks able to restate the benefit of a collaborative effort like this, where the partners are working together to provide the vaccines other than people doing it in silos?
Yeah, why don't we have each of them answer our question? That's a great question. Dr. London, we'll go to you first.
Yeah, it is a great question. I think it's something that we all explored individually to begin with, and we realized that the amount of organization, the amount that's invested in venue and all the supporting things that need to happen, that need to come together to make this work well, that's very challenging. And by pooling our resources, by pooling our expertise, we can do this a lot better for the community, and we can access larger venues like DeVos Place. And so by coming together, I think we're sending a powerful message to the community, and we're providing a better experience as well.
Dr. Almucci?
It's hard to top what Adam just said, and I agree with everything. I would say this: we're all in this together. We have been in this together since the beginning of the pandemic. I can tell you that actually between the two other speakers on the panel, Adam and Dr. Kim, we've been texting probably daily for months about everything related to COVID, and it was only natural for us to come together and say, how can we help the community in a bigger way? And as we said before, scale is key here. If we want to get shots in arms and we want to head toward that famed herd immunity, coming together will make that happen quicker, better, and easier for everybody.
And so I would also echo what Dr. London and Dr. Almucci said. And from an operational standpoint, if you think about it, with this kind of an undertaking, staffing is going to be key. And staffing is one of those things that we need to manage very well. And so our working together means that if for some reason on a given day, there's a certain type of staff at a level that one organization cannot provide, then the others will be able to step in. And so that's just an example of how, working together on an undertaking of this size it's critical. It's classic synergy.
Thank you for that. Joe, go back to Joe LaFergie for a question.
Yes, obviously you've had time to prepare for this. You knew it was coming. Why wait until a month into when vaccinations were available to set up DeVos Place?
I don't, who wants to take, maybe Daryl, you want to take that?
Sure, I'm happy. So remember, we knew ahead of when the vaccines were first made available, who the first eligible group was going to be, and that was going to be healthcare workers as well as nursing homes. And so this type of endeavor never would have been necessary or worked for that. And to be very honest, when the announcement came to change eligibility, it all came pretty quickly in this state, and we're all glad for it. But we had to move all of us very quickly. And the first thing we did was all open up more clinics and availability for the general public. But as we started thinking about the long term, getting to all of our seniors, expanding further eligibility, and hopefully ultimately the whole population, this just was the right way to go and the right thing to do.
The other thing that I would add, again echoing what Daryl said, is that from a Mercy Health standpoint, we were looking at opening up another vaccination location anyway. And so the idea that we could do this together at a single convenient location, you know, with our partners, Kent County Health Department and Spectrum Health, it just made a world of sense. Vis-a-vis your question, hey, why not wait till more vaccine is available? You know, one of the things that we've learned, whenever you start any new location, it's nice to start with a lower number than you aspire to hit so that you can really hone what the processes look like and get to that point. The final thing is, you know, just to build on the question about vaccine availability, our experience is that the state's done a really nice job distributing the vaccine, just kind of, figuring out how to make the supply work, and that it seems like, the better job you're doing of getting vaccine into people in your community, the more receptive the state is to providing more to your organization. And so for myself, I guess, I hope that our doing this and showing this is successful will help our region to increase the amount of vaccine supply.
Thank you. And I know, Joanne, you've got another question related to where folks will be directed. If you want to go ahead and ask your question, maybe Brian, you could answer that.
Yeah, I was just curious, will people be more directed to go to the DeVos Central location? Will the hospitals maintain, their clinics, or be adding more clinics on top of this? That kind of like plan.
So I'd be happy to speak for our plans. And so as we collaborate here on DeVos Place, we will look to make it as easy as possible to access, including having the on-site parking that's covered for as long as we can. We recognize as we scale up, we are going to have to scale up our facilities to match. But having help underneath in that parking garage to direct people, to assist with getting to where they need to go. And so we're going to do everything we can to make the site itself as accessible and patient friendly as possible. But yeah, we're also maintaining our presence that exists already. We may tweak that. We may find that there is efficiencies to be gained in one that might be nearby. I know that today Spectrum Health is finishing up a clinic where we partnered with the health department, and we're in a community center and targeting an underserved neighborhood. We're going to continue to invest in that methodology. We're going to continue to work with our regional hospitals to make sure that we're meeting the needs of those communities as well. We recognize that some of those, especially those near Grand Rapids, the DeVos Place Clinic, will be a really viable option, but not for everybody. And so each of our regional hospitals are partnering with their respective health departments to collaborate to do the exact same thing we're talking about doing here in Kent County.
And that's similar to the approach that Mercy Health is taking too. As Brian said, we're continuing our other vaccination sites, so this is in addition to. And so what this is about is providing an additional location that might provide a resident of Kent County, a better option, a different option in terms of location, just the kind of venue that they want, and the kind of timing they want. So this is in addition to, not instead of.
And at the Kent County Health Department, we are going to continue with the appointments that we've already scheduled at this location. Going forward, we will be using the DeVos location for our community at large vaccine effort. And then we'll be using others in our staff and some of our vaccine allocation to do some of those more targeted things that have been mentioned earlier. So it's really a dual approach here to make sure we have something for the community overall and then some resources focused on those targeted efforts.
Thank you all. I know we're getting near time, and I want to try to get to some of these last questions. So Chris Hall from Detroit Free Press, if you want to go ahead and ask your question for maybe Dr. London, you could answer.
Yes, thank you. How much is it going to cost to have the clinic at DeVos Place, and who is paying for that? And do you hope to be reimbursed at some point, such as by the federal government? Is that being offered for free, or is there a monthly charge for that?
Great questions, Chris, and there are things that we're working on right now as well. So the cost is going to be significant. The cost of not doing it is also extraordinary. And that's something we all realize, is that we have to do this. We have to get through this as quickly as we can. The financials are being handled by our financial experts within our organizations. We are sharing the expenses. The county has acquired the lease for that property. And we do have some assurances from state and federal officials that they are going to do what they can to fund this, because this is exactly the sort of solution they want to see happen in places like West Michigan. So we believe that it's the right thing to do. We believe that the finances are going to work themselves out just fine. It's important that we all step up and make this solution available as quickly as possible. And we'll figure out the details of some of the other costs as we go along.
All right, let's go to Sarah from WZZM 13, and Daryl, I think you can answer this question.
Yeah.
Hi. Hi. A lot of our older viewers, they're very frustrated. They don't know how to get online, and the question always comes back to where can they call? They get very frustrated with that. You guys, I know that you gave that 833 number in the press release. I know that the word is kind of be patient, and you guys are setting up call centers, but any other phone numbers that we can share for people to call to make an appointment for a vaccine?
Yeah, let me take this scheduling in general, and we absolutely recognize that online solutions aren't going to work for everyone. So we do have that phone number, and that number is ported to call centers that today are staffed with well over 100 people ready to answer calls. The way scheduling will work is we hope that a good percentage, if not a majority of people, will access the website. Via the website, they'll be able to have an easy process where they register. If they're calling, they will have the same process, but speaking to a person. We will have translators available for those that aren't speaking English as their first language. And the registration process will collect eligibility, are you over 65, are you a school teacher, so forth, all the pertinent information. And then we'll have a database. And then as we have vaccines and clinic slots available, we'll be able to contact individuals to say, hey, you're now up for vaccine. Please reach out to us again via this phone number or via the website to schedule your vaccination appointment. We also understand that once you've signed up, you need to know, hey, am I still on the list? What's happening? So we're working on processes now where we can update people, likely via text message, to tell them you're still on the list. We haven't forgotten about you. We're just waiting for more vaccine and your eligibility. And then just one final note, and I'm sure probably Dr. Kim has something similar to say from the St. Mary's process, but for our process, for all of those people that signed up via our initial process on our Spectrum Health MyChart app with a questionnaire, they are still in line. We will still be vaccinating them. We are actually sending out messages today. They don't have to do anything new. You don't have to call again or go on the website. We're all doing this as quickly as we can, as best we can. My final comment is, for those that do call, just have patience. We've seen across the country phone lines go down, call times that are very long. We're doing our best to minimize that, but we all have to realize the demand is high, and we're all trying to do our best.
100% echo that. Can't say it any better than Dr. Elmucci just did.
All right, well, I think we'll take one final question. I think you just answered maybe our final question there, but there is a question about, if our goal is to vaccinate 20,000 a day, how does that compare with the doses that we have available at Spectrum Health, Mercy Health, and the health department? Dr. London, if you want to take that first.
Well, daily, we're currently doing about 500 first doses at the Kent County Health Department. So, I mean, I think the answer to a lot of these questions is we need more vaccine. We need to do what we're doing and more.
Dr. Almucci?
Yeah, it's very based on vaccine supply. Right now, we have the internal capacity to vaccinate somewhere between 4,000 and 5,000 people per day. Outside of this, we could scale that up if need be, but right now we just don't have the vaccines either.
And Dr. Kim?
From Mercy Health St. Mary's standpoint, we're doing almost 1,000 a day. And again, it's the vaccine availability that's keeping our number there. What the number is, kind of Trinity Health statewide, I'm not sure what that number is, but I just want to share with everyone that I think everyone's number is going to go up. That this 20,000 number is, it's a wonderful number, and it's going to set a, terrific benchmark for others to hit and hopefully exceed, and we hope to exceed that too. And so it's going to be a moving kind of target, and the numbers are going to just go higher and higher is what I would predict and hope.
Well, thanks for everybody for attending today. I'd like to turn it over to Dr. London for some closing remarks.
Thanks, Carrie, and thanks to all of you for attending today and for your great questions. I just briefly want to say that we're, again, very excited about this initiative. We're very excited about this collaborative. We know there's a lot of frustration in the community. We're frustrated as well, and our teams are frustrated. We want this to happen as effectively and as quickly as possible. And I want everyone to know that we are all working hard and doing everything in our power to make that happen for West Michigan. And we're asking all of you to please get the vaccine when it does become available to you. We want our region to achieve population level immunity as quickly as possible. That's going to help protect you, your family, and those who cannot receive the vaccine yet. And we do realize that some people do not want the vaccine, but we do want them to keep an open mind, to explore, to become informed, educated about it, to know how it was developed, how it was approved, and that it's safe. And that's very important to us. We want to encourage you to please stay strong, stay vigilant in prevention practices that we know are working. They are working. Wearing a mask, social distancing, practicing good hand hygiene, avoiding those social gatherings outside of your immediate circle. Please keep doing those things. The vaccine is going to get us to the goal line here, but it's not going to happen quickly. We need you to keep doing those other things as well. So thank you, everyone, once again, and have a great day.
For the media who still have additional questions, please feel free to reach out to the media relations teams at Kent County, Spectrum Health, and Mercy Health, and have a great afternoon.